Good morning, guys. I hope we're all sparkly. It's safe to say that life is full of challenges. And I quite like the poem If by Roger Kipling. If you can meet triumph and disaster and treat those two imposters just the same. So when you've got low testosterone, you feel pretty miserable. You're in the purgatory. And you can't see challenges as opportunities, you see them as threats. So you go on testosterone replacement therapy and you go, right, life is peachy. Well, you've got the base and now you need to use this catalyst and make the right choices, because it's likely you've made the wrong choices in the past, and life is about learning, adapting, evolving, overcoming adversity, which is part of your reward, as we said before. So I'm feeling pretty battered right now. I've got a streaming cold. I'm on antibiotics for something that I'm not going to share with you. Some things should stay personal. I've got a few injuries. My shoulder's not perfect. My knee's not perfect. Nobody cares. Work harder. Have I slacked? No, I was at the gym this morning. I've done my C-dip. I've been in the sauna. I've got on with it, because we're physical beings in a world of psychological stress. And if I allow all my little problems to take over, I'm going to sit there and feel sorry for myself. And I don't want to do that. So I'm going to keep moving forwards. As we said before, Carl Jung, the shadow, it's always there, but move forwards and it'll always be behind you. So what else is going on at the Men's Health Clinic? Well, we've got 2 new doctors. Finally, I have some peers to bounce ideas off of. What we want to be doing is further refining and improving the service. Now, I'm 100% confident that microdosing TRT is the most effective way of achieving stable male androgen levels for long-term physical and psychological health. And that is the methodology that we should all be subscribing to. The rest is really for you to work out. How are you going to affect a positive change to your health? Take personal responsibility. Don't hand it off to somebody else. So having 2 new doctors is going to give me time to do what? Reflect and see if we can improve things. Again, be more progressive. We should always strive to improve. Never be complacent, because complacency breeds what? Contempt. And then we run into trouble, because we need effort reward. So yeah, 2 new docs. Brilliant. Takes a little bit of the stress off of me, and I can move forwards and find more avenues to explore. How exciting. Because life should be exciting. And again, you should be seeing these challenges as opportunities. But sometimes it is what it is. Karma. It is what it is. Get on with it. Nobody cares. Work harder. So what else is there to say? Well, medicine is being dumbed down. I heard on the news the other day we're having physician's assistants. You don't need qualifications. You're just going to assist the physician. I'm not being funny, but when I go to the doctor, I want to see the doctor. I want to see somebody that has been to medical school, that has continued to learn and hopefully adapt his practice to act in the best interest of the patient. Now, we have British Society for Sexual Medicine guidelines that are safe, but are they effective? Now, you know the answers to that question. We've got Society for Endocrinology guidelines. Are they safe? Yes. Are they effective? So recently they've added more frequent injections, suggesting that you can improve stability. And again, what's the premise behind TRT? Stability. And we don't want side effects. So we're hopefully not going to see a rise in hematocrit. We've actually just done an audit which has demonstrated that we don't see a rise in hematocrit with microdosing, despite cypionate apparently creating an increased rate of erythropoiesis compared to libido, but not as we prescribe it. So it's disappointing to see how regressive doctors are. So I'm very fortunate to have two new doctors. Sean, a younger, better looking version than myself. How disappointing. Yeah, well, move over. So, and Harpreet, who's my age, but he hasn't got German Shepherds. He's got Rottweilers. And we all subscribe to the same philosophy. Work harder, but appreciate balance and the necessity for contrast. So again, as you guys know, we're massive advocates of ice baths, saunas, mindfulness, grounding. The list goes on. You don't need a health coach to tell you that. You need to take personal responsibility. And if you're going to seek advice from somebody, make sure they're experienced in life. They've led a rich and valuable life. They've learned from mistakes and they show a level of humility. Because you see these overconfident people on the internet telling you how you must do it. How can you be that confident? You can't be that confident because you're just a child. So as we said before, Carl Jung, in the first 40 years of your life, you're developing a strong ego. In the next 40, you're getting rid of it. And we've all made mistakes. We're all walking wounded. If somebody's pretending to be this amazing example without showing empathy and humility, then you've got a fraud talking to you. Oh, it was definitely this, it was definitely that, and I've got this to sell you. I've got nothing to sell you apart from the truth, because if I sell you a lie, you're not going to trust me long term. And TRT is a lifelong therapy. It should be considered a lifelong therapy. You shouldn't just be jumping on testosterone replacement therapy. You should be looking to not need testosterone. But yes, testosterone can be life-saving. As I said in the previous video, we have so many people say that they were suicidal prior to TRT. And again, it goes back to Carl Jung. Jumping on testosterone is not going to bring you light. It's going to allow you to be objective and be considered. And as we've said numerous times before, it is the calming hormone. And you've got your excitatory neurotransmitters and cortisol on one side, and you've got your testosterone, the calming testosterone, and the parasympathetic nervous system on the other side. You have to understand the necessity for contrast to establish balance and harmony, baby. But there is no destination. It's about moving forwards, constantly moving forwards, not taking any days off. There are no days off in nature. So there are no days off in here. Keep going. The only time I ever feel depressed is when I sit and I think. I quite like long journeys on the car because I don't actually listen to music. I am a massive fan of music. And again, I think it was Plato. Music be food for the soul. But long car journeys allow me to focus because I'm focused on driving, which means I'm focused in my mind. Much like the gym, I'm focused, which means I'm focused. And I don't want the negativity in my brain to come to the front. Because again, I want to be the best version of myself. And the only way I can do that is to be considered. And testosterone will allow you to do that. But it won't do it for you. You can still be an absolute plonker. If you've got other things going on in your life, you have to address them. And the hardest patients that have trouble with testosterone replacement therapy don't understand that. Don't appreciate that TRT is just the foundation. So we must, I say must, look to sleep, must look to address stress, must adopt these things, these daily practices that we talk about. I ain't got time. Make time. You 100% need to do these things, and these things are free. So do them. Again, eat what you need, not what you want, and then you'll want what you need. And then physically active. We're physical beings in a world of psychological stress. I can't emphasize this enough. If you just sit there and wallow in your self-misery and, oh, hasn't life dealt me a hard hand, you're gonna be miserable because you're miserable. So get on with it. Be physically active and do what? You guessed it. Go earn your reward.